For today, our topic of discussion is anatomy of ear. So here is basically ear is divided into external ear, middle ear and internal ear. External ear, middle ear this part and internal ear. So let us first discuss about the external ear. It is basically constituted of the three parts: auricle or the pinna, external auditory meatus or external auditory canal EAC, or the tympanic membrane, or also known as eardrum. It all constitutes about external ear. So first we discuss about this. Here is auricle or pinna. This outer one is helix. Opposite to it is antihelix, this one, and it further divides into two and forming the two crura of the antihelix, which enclosing a depression or a fossa known as triangular fossa. Next to it is helix, antihelix, and here it is a crus of helix. Next is it is a tragus. Antitragus opposite to it. It is a lobule, which everyone knows. It is a concha here, and concha is further divided into two parts: cymba concha and cavum concha. Cymba concha is the upper part, cavum concha is the lower part. In respect to the crus of the helix, it is upper part and it is the lower part. So, and this is the area where there is no cartilage. Therefore, it is used in giving the incisions, because where incision is given with no cut on the cartilage, so it is a safer side, incisura terminalis. In between the helix and antihelix, there is a scaphoid fossa. Okay, so four fossa or depressions we have studied: scaphoid fossa, triangular fossa, cymba concha and cavum concha. Okay, next to it is external auditory canal. This is the external auditory canal. More briefly, we can see here external auditory canal. So it is it extends from the bottom of the concha to the tympanic membrane. It is 24 mm long. It is divided into two parts: outer 1/3 and inner 2/3. Outer 1/3 it is cartilaginous and it is 8 mm. Inner 2/3 it is bony and is 16 mm. So from this we can learn B for bony, B for big and 16 mm. So clearly learn. What is the direction of it? It is going upward, backward, piche, and medially. Obviously from this diagram we can understand external auditory canal only travels in the medial direction. So upward, backward and medially. And this downward, forward and again medially. Okay. So here is a narrow portion known as isthmus, which is 6 mm from the 6 mm lateral to the tympanic membrane. Here it is a tympanic membrane. It is a 6 mm lateral to tympanic membrane, narrowest part of the external auditory canal, isthmus. So here most of the infections lodge, medial to it most of the infections lodge. So it's very difficult to treat it. So in this we have to learn three main important things. In the external auditory canal, we have to learn three main important things. First one is fissure or foramen of Santorini. It is the depression or the fossa or the foramen which connects to the parotid gland or skull bone. Therefore, the infection of the external ear, that is otitis externa, leads to the parotitis, skull base otitis. And second is foramen of Hashke. It is seen up to the 4 years of the age, permit infection to the parotid. Again the same pathology. Next is glands. We have two types of glands: apocrine and sebaceous glands. Apocrine is cerumen, secretes cerumens, and sebaceous gland secrete the sebum, which ultimately constitute of a vex.